Coronavirus has spread rapidly around the globe, wreaking havoc on healthcare systems in nearly every nation. Here in Australia, we've flattened the curve pretty well, with the total number of daily reported cases dropping from 468 at its highest to just 10 on average. But would our response have been so effective if we were further down the path of privatisation or Americanisation, as our peak medical bodies have been warning against for years?
Hi, my name is Simon Penny. I live in Sydney and I had coronavirus. It was suspected I was corona because my parents first had symptoms and then my symptoms came on. I had a fever for about 6-7 days and it was pretty unrelenting.
Simon works in the health space himself as a physiotherapist, so he sees firsthand the importance of low-cost healthcare.
Really, I do think I was fortunate. For many people, if there was sort of, at least in Australia, some sort of fee or you had to pay a significant sum of money to then get tested, it would have affected our response regardless. We didn't go specifically to the COVID clinic. We went to a separate clinic for infectious diseases within St Vincent Public. And for that, I don't think any costs were incurred.
The Australian Medical Association has cited funding black holes in Australia's healthcare system, as well as increased corporate powers in health insurance as indicators that we may be moving closer to a US model. With 44% of Americans declining to see a doctor due to health costs, this hasn't and wouldn't fare well for countries in crisis.
For me personally, it's sort of my civic duty or my social responsibility to get checked. I did find particularly regarding policy and lockdown policy, somewhat hard to navigate though.
Coronavirus showed the strength of our healthcare system, proved by the smooth experience of people like Simon. The way it stands now, maybe we do live in the luckiest country in the world, or maybe this experience might be short-lived.